time remaining one you set here. Here you 15 minutes is there. Then you can increase, decrease when you press that one. Okay, for example, I keep. So we have this is intermittent. We can see this is intermittent. This progressive, we have regular. Progressive means how is going up. Regressive means how is coming down. Okay, the pattern of progression and regression. If you keep this one here, okay, so the progression will be like intermittent. It will put a static hold and it will be see. Based on according to the graphical representation, no, it will it's keep on progressing, then it comes down. So I'm keeping static, intermittent, mostly static and intermittent will keep. This particular period will be, it will continuously in the park in this particular stage it will keep on pull. Okay, then after that, then slowly comes down. Intermittent is hold, then it comes down, release, then hold, release, like, but the force will be maintained. Okay, how much traction force is maintained here? Now, for example, here is 2 kg. Okay, this is a 4 kg, 5 kg, 6 kg, 7 kg, 8 kg. The 8 kg will maintain, then 7 kg, 6 kg. So it will maintain. Finally, it comes to 0. How you want to make it? Usually, we make it intermittent. Okay. We give the intermittent.
Usually, it's intermittent.
Intermittent. When you want to keep static, when you want to keep intermittent, and depending on the clinical condition, you will decide. I think Dr. Ram will be spoke about that.
Can you give an example? Can you give an example?
Examples, what example we
Like
can give?
when can we use intermittent?
Usually continuous traction we will not use in, for example, in case of severe muscular spasm, we don't use that continuously.
So not
Okay,
intermittent.
we'll keep it intermittent.
Keep it intermittent.
Yeah, intermittent.
Okay, but there's no muscle spasm setting, only the disc is compressing.
Yeah.
In that time we will use what is that, only static. Usually in a static mechanic traction we will use in orthopedic setup. Okay, if there is a muscular involvement you cannot keep it continuously. Okay, anyway you should know the intermittent how to set it. Okay,
You keep all these settings in intermittent.
intermittent,
Progressive.
yeah, intermittent step. Okay, and the steps means how many steps he is having. For example, I give 2 steps. And 2 steps means it goes only 2 steps up, and for example, I'll keep 2 steps here also. So only 2 steps, 1, 2, 1, 2.
Based on what?
Progression 2 steps. Here, how many kgs is going to? Maybe if you are keeping 8 kg force, then 4 kg will come first, then 8 kg. 8 kg will maintain, then 4 kg, like that. 2 steps.
Okay.
And the steps we can increase. Usually we keep some 4 to 6, 4 steps this side, and 4 steps. So more steps, it will more convenient for the patient.
Okay, so
Yeah.
for
Yeah,
either-
like that.
Okay.
Okay, so slowly progressing and slowly lowering the resistance. Okay,
What's the
traction.
maximum steps we can?
Maximum we can keep depending on what's that. Say usually we'll keep 6.
Okay.
6 steps. By default will come 6, but if you want to reduce this one, you can. For example, you want to do the continuous traction, but instead of keeping 1 step, we can keep 3 to 4 steps, 2 to 3 steps. It's almost like this is continuous traction will be there. Instead of keeping the 8 kg for throughout the treatment time, it will be, we can keep it 4 kg, 6 kg, 8 kg. So like that we can keep. Okay. Right, then time also you can set. Progression time usually we used to keep similar. For example, if you keep this one only 1 minute, and everything traction, progressive traction will be more timing. Okay, only very less time for the down.
Okay, done.
Okay, so better to keep the equal so that it goes pulling and maintaining, so that there will not be any kind of suddenly, otherwise sudden is the soft tissues are stretched, pulled. Okay, slowly you can release, slowly. Suddenly if you are releasing, sometime there is a possibility of the tissues will not come back to the original mechanical state. Okay, so like that you can set, usually keep intermittent. Okay, and steps you will keep 4 or 6. Okay, and how much time you want to give? I want just keep 20 minutes, right? So here 4 minutes, that 4 minutes goes up, 4 minutes comes down, then that means 20 minutes, though 5 times it goes up and down. Yeah, 20 minutes he kept, 4 minutes for going up, 4 minutes for coming down.
Okay.
So 4 into 5 is 20. So 5 times it goes up and down. That is a cycle, it goes. Okay. Then once everything is set and patients are positioned correctly, right? Then press this one and release. And don't leave like this, it will go and strike and damage it. So leave this one, press again, just to move like that and leave. These are the safety procedures you must follow. Once everything is done, keep the patient to the sideline for 1 minute, and then you make the patient in sitting. Ask the patient sit for some time, check whether the patient is having any kind of giddiness or some. Okay, if nothing is there, then you can send the patient. Then give the phone program and you can leave. Okay.
The maximum level weight and minimum level
Which one?
right here.
That one also I can keep how much. For example, cervical traction I am keeping for the 87% of the body weight, right? So for example, I am keeping 5 kg for the maximum. You can keep 5 kg. Minimum, you no need to bring it to the 0.
Okay.
I will maintain almost like 3 kg. From only 3 kg, the step 1 will come 3 kg only. 3, 4, 5 or 3.5, so like that will come 3, 4, 5, 3, 4, then 4, 5, 4, 3. It will not come to 2 or 1 or 0. So that it will maintain the force. It will not come to the 0 and it will maintain that same level. So according to this, we can set the maximum should not exceed that the values.
7%.
Yeah, that's 7%. Okay. So that is, you can set everything, then fix it with the patient and you can do it.
We just click start.
Then you have to start. Then you have to start. Okay. Then give this one to the patient. Give this anything any time if the patient is having discomfort, and ask the patient to stop this one. Okay. And you are not supposed to go out of the patient, and you have to be there with the patient for long. Then sometimes the patient will sleep. Okay. And make sure that the traction force, how much maximum you are keeping, that should not exceed. By unknowingly you should not select that for lumbar traction force into the cervical traction. You should be very careful in that area. Okay. This one minimum we can keep 0, also not a problem. Okay.
Even for
But you
even for lumbar, we can keep minimum as
0 we can keep, but no, actually when clinically if you think 0 what you want to keep maintain some traction force. So that's it. For example, you keep 25%, you get starting 25%. 100 kg person, 25 kg you are keeping. So the traction force minimum you can keep almost like 15 kg. So the 15 kg force will be there continuously. This is a panel. You should know that how the panels it has to be Done. Okay. Stop.